Sounds like a great cooperative effort. Speaking of cooperation, I understand that the United Way is a great resource for the center as well.
Well, I'm glad you mentioned that, because without the United Way's support at the outset, we would not have been able to get started as effectively as we could have. It was their seed money and their willingness to serve as chair of your 10-year homelessness or your housing development plan, and to provide some leadership to the Housing Works project, which was our demonstration effort that we could actually do this, that I think made a big difference. So they deserve a lot of credit for kickstarting us and actually for being there with us still today. Thank you for mentioning that.
Now, over time, the concept really is an actual savings of money because of really trying to take care of the issue of homelessness. Versus what was in the past, which was a temporary shelter. Can you elaborate on that more? Like, if we take care of an individual or a number of guests now, the society in general longer will have a cost savings.
Well, the logic is if we can eliminate homelessness, we're going to eliminate all the overuse of the emergency services and basic services that we have, Dennis. And I did an awful lot of research on this when I was developing the proposal for your consideration. And basically, what I discovered is that in every location around the country where Housing First was put in place and was properly managed, there was a reduction in cost of emergency services, sometimes literally 25 to 35% reductions in cost. Now, when you look at it, and sometimes we don't think of these things, the use of the emergency room, the use of the jail, where often the jail becomes the only resource that a homeless person has access to, the use of emergency services like police. These get overused when you allow homelessness to persist and to become unserved in the community. So placing them in a home is less expensive, and in the long run is going to reduce the cost for all of us, because we're paying for this through our tax dollars.
There were so many things in the center that impressed me, but one of them that I noticed particularly is that the guests are encouraged to keep busy during the day. Televisions are shut down during the day. There's no one hanging out.
Right.
They're encouraged to be proactive about finding a job or getting the resources to get them back on the road to self-sufficiency. Where did this model or idea generate?
Well, Julia calls this tough love. Okay, so maybe I should call it that too. But when we designed the center, and Julia was helpful in having us think this through correctly, it was our feeling, and I believe we were supported by most of the social work community, that you needed to have a tough love approach. This was not about come in and have a cup of coffee and accept your way of life. We're going to try and help you. You're going to have to make a decision to be helped. So when they come into the drop-in center, that's not just to keep them out of the cold. Yes, they can come out of the cold, but the objective there is to get them engaged with the services that are available to them at the center, to help them find a job, to help them get the health care they need, and get them into a home. That's what the most important thing is.
What's the future of the center itself? Where do you see in 10 years in terms of growth?
Well, if I were a dyed-in-the-wool idealist, I'd want to be. I'd want to say to you, well, it's going to be empty, and we can use it for another purpose. But I think what we're doing here is breaking good ground. We're establishing a change in the culture of the helping community. This is a major collaborative effort. And the agencies of the community and the departments of the public sector and government are working together more intimately than they ever did in the past, which means that they're lending support to one another, and they're creating a new way of delivering care. And they're delivering it in one site. So I think the long-term goal here is to create a model that possibly could be emulated in micro sizes in other areas of Bergen County where needed with combinations of services in those locations so that we reduce the pressure on our transportation grid and we increase the capacity of our people to get the services that they need.
The center opened in October. What are the greatest changes that you have seen since the center, as it referred to Hackensack or the surrounding areas?
I believe that what I've found to be the biggest change is a change in hope. When I go to the center, I see people who are being helped and being animated and treated with the respect that I would hope we all treat one another with. And the fact that the center has been able to place 38 people in permanent housing in such a short period of time tells me that we're on the right track and we can get the job done.
Okay.
Well, thank you again. I want to thank you, of course. We're out of time, but I just want to thank our guest, Julia Orlando, the Director for the Bergen County Housing, Health, and Human Services Center, and Clark LaMandola, the consultant who helped make this important project happen. I also want to thank my co-host, Freeholder Elizabeth Calabrese. The Bergen County Housing, Health, and Human Services Center is an important initiative for my administration, and I'm very proud of the center and look forward to hearing more about the positive changes it brings to the many people of Bergen County. Thank you again for watching this edition of Inside Bergen. We'll see you next time.